Why do giraffes have spots? An incredibly interesting question, and even more interesting that we're trying to answer this in plastic and reconstructive surgery. Well, one of the great things about our specialty is that creative thought really has no bounds. And one of the great creative minds and anatomists of our specialty is Professor Ian Taylor, who described to us the concept of angiosomes. Basically, everywhere in the human body, every piece of skin and subcutaneous tissue as a three-dimensional unit has an artery that supplies it and a vein that drains it. And that unit is called an angiosome. This concept has been incredibly important for us in terms of the understanding of anatomy and also for what we do in reconstructive surgery when we're trying to move tissue from place to place. So what does this have to do with giraffes? So in this paper, Dr. Taylor and his laboratory evaluated spots in the giraffe and found that these spots are actually angiosomes. But more interestingly, these angiosomes have a distinct organization in terms of blood supply, such that there's an artery that brings blood to the spot that then fans out in a radial pattern that then connects to veins that surround the spots. The veins that surround the spots have high blood flow connections to arteries. And these connections between arteries and veins that are high flow are called arterial venous shunts. These shunts are well known to be important in temperature regulation. So basically, when these shunts are open and there's a lot of blood flow, heat will dissipate quickly. Whereas when they constrict down, heat will actually be retained. And this is interesting because this is not present in other animals with spots like jaguars, for example, or zebras, for example. So what does this mean for humans? Well, we already know that angiosomes are here to supply blood to a unit of tissue. Now, what we know from the giraffe is that this type of organization can also have other functions, and one of these functions is temperature regulation.